Today we have Dr. Alessandro Thione, and he is a plastic surgeon in Spain. How are you, doctor?
Good morning.
Can you tell me a little about your practice and how you got into plastic surgery?
Sure, yes. I'm a plastic and reconstructive surgeon, and I've been trained in above all in microsurgery and reconstructive surgery. But I perform aesthetic surgery too. It's not the preferred part of my career, but I'm I mean I can do both reconstructive and aesthetic surgery, mainly microsurgery and reconstructive, but also aesthetic one.
How did you get into plastic surgery?
When I was a child, the main episode, I think it was an hand amputation of a famous person in Italy, and I liked the idea of the replants of the hand, and so I started when I was, I think, 10 years old, thinking about plastic surgery and reconstructive surgery, and then I decided to do medicine and plastic surgery, and I like it since the first moment.
Wow. So what's the best part about being a plastic surgeon?
The best part at the moment, I think, to try to improve the life of my patient after a trauma, after a tumor. And we have the possibility to give back what they have lost in the best way is it possible. So I think this is the best part of my job, trying to give back to the patient what they have lost due to a trauma, but also a tumor or a congenital malformation.
And what's the hardest or the worst part about working in plastic surgery?
Not to reach this goal. I think this is the worst part. When you tried and you cannot. So this is the worst part. I don't like when I don't manage the goal. I don't manage what I have told the patient, because this is not math. So we have good results, and sometimes we have bad results. So this is the bad part, when you cannot do what you told to the patient.
What's the hardest demographic that you work with?
Maybe the child, because it's difficult to make them understand what are you going to do to them, and sometimes there is a very difficult surgery and they cannot understand what you are going to do in the post-operative period. Maybe for them it's difficult to understand why they cannot do a thing, or they can stay in the bed during a lot of days in the same position. So this is the most complicated patient, I think, to deal with.
And so what is the greatest struggle in your practice? Like, most businesses struggle with money, time, people, and passion.
It's difficult to have time for all the patients. So this is the main problem you can have during your daily activity. Money is not a problem, must not be a problem, I think, because I'm talking about the reconstructive part of my job. The aesthetic is something different. The money is the 50% of the importance of the aesthetic procedure. But
how would your family and friends describe you outside of your practice? Like, what do you like to do outside of work?
Good question. I think we should ask to them. But I'm sometimes they say that I'm a workaholic, that I work too much in the hospital, too much time in the hospital. During these last 9 years, I've spent a lot of time in the hospital, and maybe I forgot the family, and this is not a good thing to say, but I think this is the reality. So maybe they can say that about me, that I am too workaholic.
So do you have any hobbies or passions outside of your practice, outside of working?
Yes, of course. I try to have. I like swimming. I like biking, and when I have time, I try to dedicate myself to sports like this.
So what would you say is the difference between plastic surgery in the US versus Italy versus Spain?
I don't know. I've never been in States, so I can imagine about talking about plastic surgery in States, speaking with my colleagues, but I've never been there. So um, I think we here we have a saying that is Mediterranean style, no? Because we do things in a simpler way a lot of times, uh, respect to the United States. But I really don't know the activity over there, so I cannot do I cannot say what I think about because I don't know. So it's difficult.
Do you speak with a lot of cosmetic surgery patients, or is it more reconstructive? I mean, do you ever do breast implants or Brazilian butt lifts?
Of course, I think during the morning it's reconstructive time, and during the afternoon it's aesthetic time. Uh, the I'm I mean the patient of aesthetic surgery is more a client than a patient because really they have not a real illness. They are not ill. They are healthy people and they are trying to improve with surgery their aspect. So it's a dangerous situation because you are touching with surgery and healthy people and you have an obligation to reach the goal.
Which procedure is your favorite?
My favorite, I think, breast augmentation. My favorite because I do a lot, and maybe liposuction, blepharoplastic, but the breast surgery is my favorite.
How often do you find patients that come in with sort of like, I guess, mental illness in the sense that they either have like body dysmorphia or anorexia or something like that? You know what I mean? Like, how often do you see those patients versus patients who just want to make an improvement?
Yes, I think it's 5% of my private patients can have this problem. I'm trying to select the patients. So when at the first visit, if there is a clue about this kind of problem, I try to elegantly discharge the patient because that is a real problem. You shouldn't operate that kind of patients. I think it's an error to operate them.
Do you ever like, you know, if a 13 or 15-year-old girl comes in and she wants a nose job or breast implants, what would you say to her? I mean, today we have the Kardashians and all this kind of media production of women enhancing their bodies. And I mean, do you think that's okay?
You should dedicate the double time to them, to speak with them alone and with the parents. Both things. You should do the both things. Speak with the parents and the patient together, and then only with the patient. But you don't forget that they are under 18, so parents must sign the consent, the informed consent. So the best way to do this is a lot of time dedicating to them, to speak with them, to try to understand what they really want, and try make them to understand you about what you can do for them.
Do you have any daughters?
No, daughters and sons. I am alone with my wife.
So what gets you out of bed in the morning? Like, what are you most passionate about in life?
Breakfast time. I like breakfast time. And then of course go to work. But the breakfast is the best moment of the day because I like to have a long breakfast and it's the moment of the day when I think about what I have to do and I'm trying to schedule my day. So I like this moment because I think it's part of of my of my job in the wide sense because I think about what I have to do and I try, of course, to spend time together with my wife because then after, till the night I cannot see her. So it's, I think, the best moment in the day.
So do you have any more life goals, like any long-term goals that you haven't achieved yet?
Yes, of course. I'm to improve my skills. It's in my job, of course. And then when I will be older, try to learn more languages. I like I like languages, and I'm trying to learn other languages. I have no time, so I do it in the car maybe. But when I will be older, I will do that, sure.
So, and you're in private
My,
practice, right? Or do you work in a hospital?
it's hard. Yes, but I think a doctor should work in a hospital, because the hospital gives you back a lot of things, a lot of satisfaction. I cannot see myself out of a hospital. Of course, we have our private clinic, but I like very much to go to the hospital in the morning, because that is my real activity. I think that it's the most important part, and is the part where you can improve your skills, and that are, after are useful also in the private clinic. But the hospital is your home, must be your home.
So what would you tell a young upcoming plastic surgeon? You know, like someone who hasn't had the experience that you've had, you know, I mean, I don't know how many cases you've done, but
A lot. I'm young, so I have to do a lot of cases. But in advice, I can say, put all the enthusiasm you can in what you are doing in each moment of the day. That is the strength to reach your goals. The enthusiasm. Be happy doing what you are doing. If you are happy doing what you are doing, you can do everything. You can stay 14, 15, 16 hours a day working, but only if you are happy and if you really like what you are doing. Otherwise, change what you are doing, of course.
wow. So where can viewers learn more about you?
My website. I think it's very simple, but you can have a look at what I am, my curriculum, and where I work. So I think my website, and of course maybe in the Facebook, Instagram. Now it's quite an obligation to have social networks. My website is www.alessandrothione, my name and my surname .eu.